The glute max relies a lot on the hamstring, the quadricep, the gastric and the soleus to be successful when we're running and standing, okay? So how you might see this clinically, where you might be actually looking at the glute max and doing your best to try maybe strengthen that or isolate or whatever, whereas actually it may be a problem with the tissues below it. Let's just have a look at some things that certainly I see in the clinic. So one of the big things that we're going to see is when you get someone to do a lunge, for instance. And when you ask that athlete to do a lunge and push back again, what we're looking for a lot is what's happening at the knee joint. Okay, so again, when I'm going to lunge here, you're going to see a lot of athletes that may be inefficient with a core contraction around the knee, almost need a little bit more of a counter movement. Okay, so again, when their foot hits the floor, you want them to come back up again, nice and snappy. Whereas a lot of athletes, when we get them to do this at speed, you'll see they just need that extra little second where they sink. Okay, now again, when that foot hits the floor, there's a lot of things happening here, okay? Our hamstring and our quads, along with our gastroc, they're all going to be co-contracting, okay? And again, our soleus is going to want to be quite active as well when that foot's pushing into the floor. So these tissues here, if they can get a good co-contraction here, that's going to allow us then to generate torque, okay, from the hip efficiently, okay? So we almost delay that knee extension to allow the hip to come back from a flex position and generate hip extension. Whereas a lot of athletes that I see when we do these movements is if they don't have an efficient co-contraction, is we'll start to see knee extension. Okay, so as they push back up again, they'll really push back with a knee extended. So we're really looking, can they actually delay that knee extension to give them time to generate torque at the hip? Okay, so that's something clinically that you might see. We'll also see this a lot, especially with kind of top end rehab, is when I might put an athlete into a position and I want them to really explode. Again, we might see that they can't hold that knee flexion, and we start to see that knee snapping back as they maybe accelerate or whatever. And again, kind of my interpretation of what's happening there is vastus lateralis is pretty much a pretty powerful hip extensor almost, or works like a hip extensor sometimes by snapping the knee back. Okay, so again, we've got a lot of tissue here on this lateral side of the leg. So again, if that inefficiency is there around the knee, then very often we see that vastus lateralis will drive knee extension. Okay, so again, if we have knee extension, what's happening is all of a sudden that glute max is at end range. Okay, so again, for the glute max now to do the same job that it needs to do from this angle, it's going to have to produce a lot more force to do the same work because it's going to be at end range. Okay, so that's where then the glute max, it's not really the glute max's fault, but actually it's the inability to hold that co-contraction of the knee to give the glute max time to be successful. Okay, so in my return to play course, what I'm going to show you is how we break all this down, because unfortunately for me, I can't say with the utmost certainty here that just because someone sinks down here and they can't delay that knee extension, that that's because of X, Y, or Z. That's going to be very, very specific to the athlete. And also it's going to be very, very specific to their injury history. Okay, because everybody moves differently in regards to either noxious stimulus or a pain experience. So that's really the value in having that bespoke assessment to that person and not relying on cookbook exercises. Because what I do to sort this issue out for maybe two rugby players will be completely different. Okay, so just because we know the problem, we don't know what's driving that. Okay, and that'll be very, very specific to the person. So I wish there was a cookie kind of cutter approach that you could give an athlete to fix this, but we need to understand why the intent isn't there through certain tissues that we find with the assessment. Okay, so in the return to play 2-day course, I'm going to go through how to have that graded exposure. And there is some simple ways that we can use, but also there's some simple ways then that we can show the nervous system that it's safe to produce forces, okay, in certain directions where that athlete and their nervous system may have that perceived threat still. Okay, and I see this in pretty much every day, okay, with the professional athletes and with non-sporting athletes, is very often it's a lack of intent, okay, as opposed to a strength issue. Okay, Now, the strength and all that will come naturally, but first and foremost, to have strength, we need to be able to build tension. Okay, so that's very, very important that we've got that neuromuscular intent, that the nervous system is happy to build tension. Okay, so if you want to know more, check out the link either below or above this video. There'll be a link there to the 2-day return to play course. As I said, we're going to go into this in a lot more detail, and we're going to show you how to not only restore at low level, but also how we need to do this subconsciously as well, so that the athlete understands that, you know what, in times of unpredictability and chaos, such as in games, they don't have time to isolate a glute, or they don't have time to isolate a calf or a hamstring, that they all have to work together at split second.